Good morning, good day, and welcome to yet another session on how we try to bring AI and practical scenarios which you come through day in and day out. So, this particular session is on AI in predicting surgical site infection. And you know the definition of a surgical site infection. I'm not going to go into the basics. Now, these infections can be superficial. For example, you see this purulent material here. This is a wound on the abdomen which you have made, surgical wound, to gain access for some surgery, and it has got infected. Now this infection can be in the skin layers or it can be in the deeper layers of the abdomen. Of course, you're going to have more issues there. Or it can be infection inside the abdominal cavity itself. Let's not go into the details. I have made a separate video presentation on surgical site infections for students who want more technical depth about this issue. Our objective, or my objective, is only to tell how AI can predict surgical site infection. The clinical image and scenarios are from my personal collection and patients have given consent. You know now what's the definition and what is the impact. Whenever there is an infection, it needs a lot of addressing, needs dressing, maybe needing even antibiotics. So it adds to the morbidity. And if layers of the wall, see, after some time, if untreated, this can go into deeper layers of the abdomen, and you can see the layers of the abdomen itself have gaped. Now, this can lead to incisional hernias, long-term outcomes. Incisional hernias come with their own issues. Number one, bowel can get adherent to the scar, or omentum can get adherent to the scar. So, can we use AI? Even clinically, you can predict certain operations, certain patients. You can say these patients are likely to go into surgical site infection more than the other group, which have a few other risk factors. But an AI can analyze the clinical data from the patient outcomes and it reduces healthcare burdens. You need not sit and every time decide what are the risk factors for this patient, how do I compute risk on him. The AI will automatically do it and flag issues for you. Now we'll go into it a little bit in detail. So surgical site infections and surgical wound infections, they are the maximum in a hospital acquired infections. Hospital acquired is also known as nosocomial. Now, when I mean surgical site infections or hospital acquired infections, it does not mean that the bacteria was lurking in the hospital atmosphere. The bacteria could have been lurking in the skin. You get normal common salts there. And once a skin breach is there, they can become pathogens. Similarly, you open the intestine. It is teeming with trillions of common salts. But the moment those spill over into non-native tissues, apart from the intestinal lumen, when they come into the abdominal wall, they become pathogens. So the opinion should not be that hospital acquired means, especially in abdominal surgeries, that the infection has been, that the bacteria or the pathogens have been lurking in the hospital atmosphere. Number two, it could be from the surgeon's skill, the surgeon's hands, or even in faulty aseptic, not aseptic instruments. So now what are the factors? Look at the factors. They are patient-related factors. Their patients can contribute to their own infection. In fact, there are quite a few of them which are usually found. Advanced stage, yes. Diabetes, 50% of our surgical patients are diabetic. They can have jaundice, they can have various levels of organ failure, they will be smokers. Obesity is a big issue now. You cannot get rid of it. And then you have the intra-op factors. The intra-op factors are basically the local factors, surgical skill and technique. Now suppose you're leaving too much of suture material which is unwarranted, or you're putting an implant, your prosthesis, like you put a metal plate to fix your bones, or you put a mesh for your hernia repair. or asepsis at various levels. Your central sterile supplies department will start off the process. There can be breaks there. Of course, there will be checks and balances. There will be breaks during transport. There will be breaks during receiving in the OR. There will be breaks during deployment of that particular material into your patient. We are not going to go into those details at all. It's beyond the scope. Now, the type of surgical wound. Suppose I do a thyroidectomy. It's a clean wound. There are definitions for each wound. Again, I'm not going to go into detail. So, suppose I say I'm doing a hernia surgery in the groin. And this hernia surgery, I only tackled the hernial sac. There were no contents. It's a clean surgery. But the same hernia surgery in a groin done for a subcutaneous abscess, for the same incision in the groin done for a psoas abscess or for a suppurative lymph node becomes dirty. Incision is in the same place, done by the same surgeon, but the classification of that particular wound changes. So this is important. So if you really look at it, why do wounds get infected? It's because of a beautiful interplay of these factors. They are not in isolation. One patient may have more than one factor acting on him. Very difficult for a surgeon to tease out which exactly factor acted on him to produce this wound infection. So now you know clean wounds. Example of a clean wound is a mastectomy for a CA breast. The probability of wound getting infected is 1%, and then up to dirty is 25 to 40. Now I'm not particularly explaining between clean and dirty wounds. What are the criteria to label them such? There is a YouTube video which I have made on surgical site infections. Please go through it. This is not a technical presentation. This is just to tell you how AI can help. So now let's have a look. You have opened the abdomen for peritonitis. You can see the pus flakes here. Now the wound that you have made on the abdomen is classified as dirty. It's not yet dirty. It's a clean wound actually. You opened it. But the things inside are likely to make this wound infected. So what happens? Not all of them will become infected. They can heal nicely. 60% will heal. But a big 40% will go into this. Now when I open this patient, I can tell that he may be in the 60% or he can be in the 40%. That's all. And sort of take preemptive measures because I know this rate is very high. I wouldn't want him to go here. So I take some preemptive actions. But I don't know exactly where he will go. So how does AI help? Now what happens? As I told you, these are the factors that AI will try to get, and these factors will be very much available in your medical records provided it is available for your AI to peek in. You would have written the type of surgical wound. You would have written the procedure you have done, whether you put a metal plate or a mesh, and obviously you will write asepsis maintained. Fair enough. Nobody goes checking into the CSST time and again. You will check only when there is an outbreak or when they do routine quality checks. But other things will be easily available in the case sheet. So AI will be looking at all these factors and processing. Whereas as a surgeon, I will know these processes can affect this patient, but I wouldn't know how far are they going to affect him. That is the importance of AI. So there is a machine learning algorithm. It sort of looks at all these text data and it's sorts of able to tell exactly where is the compiles these data and tries to analyze and also tries to reason and come to a conclusion. Now there is something known as visual data. It's not only text data, it can also take multimodal biosignal. For that, your text will not help. You need sensors. Sensors are placed. Nowadays, every sensor can be placed into a cell phone. And as you know, smartphone penetration is very, very high in India. So that sensor, we are not again going to go into the detail. The sensor will pick up this map. It will tell you even areas of increased temperature. It may even tell you by fluorescence that there are patches of pathogenic bacteria sitting there. So what you see as a clean wound, a day earlier, this AI can tell you, no, this patient is likely to have an infection. This is the role of AI. It can be from 21 to 48 hours. It will be warning you and even flagging you. You need not even ask the AI. You have deployed it in such a way that it will flag you straight away regarding this patient. So have a look. This is the clinical photograph. This is the AI generated stuff, and it shows that this is gram positive bacteria infected wound, and when you do a culture it is Staph aureus. Similarly, there is another picture here. So AI generated images of that particular patient can tell you that yes, there is bacteria here, whereas just a naked eye examination by the doctor or the healthcare worker will not give much information other than telling it's only infected. So that is it for this session. Thank you all very much. This is on behalf of Docs Tribe AI, and I do request you all to post your comments, your insights, your critique, your criticism, because all these will help me to improve, because they will ultimately make me go and read up. So thank you very much, and please do follow up the YouTube channel regarding the technicalities of surgical site infection, which will be given in the different clinical scenarios. Thank you very much.